Protection from infection, hygiene. Module content. Module outcomes. Aim of the module. Natural barriers. Unspecific defense mechanisms. Specific defense mechanisms. What is an infection? Infection development. Blocking body defenses. Dysfunction of the immunological system. How does the body fight infections? Causes. Signs and symptoms. Treatment. Infection prevention. Tips. At the end of the module, patients and their families know. Expand the knowledge in the area of health. Be able to clearly identify what defense mechanisms are, what an infection is and how it is identified, and especially how to act in the event of an infection. To become more informed and aware person about the risks of an infection. Aim. In this module, it is aimed to inform you about what are the infections, how to identify infections, how you can protect from infections, natural barriers. Our body has defense mechanisms to fight the different agents that can invade the body and cause infections, or even allergic reactions. The body's defenses against infection include natural barriers, such as the skin, nonspecific mechanisms, such as certain types of white blood cells, fever, and specific mechanisms, such as antibodies. The function of the immune system is to recognize the attacking agents and defend the organism from its action. As a rule, if a microorganism crosses the body's natural barriers, specific and nonspecific defense mechanisms destroy it before it multiplies. Unspecific defense mechanisms. Any injury, including an invasion of bacteria, causes inflammation. The inflammation serves, in part, to direct certain defense mechanisms to the point where the injury or infection is located. Fever, defined as an increase in body temperature above 37.70 C, is also and, in reality, a protective response to infection and injury. The high body temperature stimulates the body's defense mechanisms while causing relatively little discomfort to the individual. Fever-causing substances are called pyrogens and can come from inside or outside the body. In general, fever has an obvious cause. However, infection is not the only cause of fever. It can also be the result of inflammation, cancer, or an allergic reaction. Specific defense mechanisms. Organ defenses. Natural barriers. Specific mechanisms. Nonspecific mechanisms. Immune system. Recognize the aggressors and defend the organism from its action. Immunity system. It forms an elaborate defense system that protects the body from the invasion of foreign substances, such as bacteria and viruses. What is an infection? The infection occurs when bacteria, viruses, or fungi invade the body and the immune system is not able to destroy them quickly. People with cancer are more likely to develop infections, as treatments weaken the immune system. Any injury, including an invasion of microorganisms, causes inflammation in the affected area. Inflammation, a complex reaction, is the result of different circumstances. Infection development. Infectious diseases are usually caused by microorganisms that invade the body and multiply. There are many types of infectious organisms. Here are some examples of how microorganisms can invade the body. Through the mouth, eyes, or nose. Through sexual contact. Through wounds or stings. Through contaminated medical devices. Infection development. The microorganisms have to multiply to cause an infection. After multiplying, one of three situations occurs. Microorganisms continue to multiply until they overcome the body's defenses. A state of equilibrium is reached, giving rise to a chronic infection. A body, with or without medical treatment, destroys and eliminates the invading microorganism. Infection development. The permanence of the microorganism near the invasion site or its spread to other places, as well as the severity of the infection, depends on factors such as the following. Whether the microorganism produces toxins, enzymes, or other substances. If he develops resistance to antimicrobial drugs. Whether it can block the body's defense mechanisms. How the person's immune system is working. Infection development. Many disease-causing microorganisms have properties that increase the severity of the diseases they cause, virulence, and help them resist the body's defense mechanisms. These properties include toxins, enzymes, ways to block the body's defenses, production of toxins and enzymes, blocking of body defenses. Some microorganisms have ways of blocking the body's defense mechanisms, such as the following. They interfere with the production of antibodies or the appearance of T cells in the body, specifically prepared to attack microorganisms. They have layers of external protection that prevent white blood cells from swallowing microorganisms. They have resistance to rupture by substances that circulate in the blood flow. They produce substances that counteract the effects of antibiotics. Dysfunction of the immunological system. If the immune system is not functioning well, people are more susceptible to infections. The immune system may not function well due to the following. People who are born with a hereditary disorder that damages the immune system. A disorder that is acquired later weakens you. People who need to take a drug that suppresses the immune system, such as those used to prevent rejection of a transplanted organ, or corticosteroids, used to reduce inflammation. How does the body fight infections? The immune system helps the body to protect itself against infections. The immune system includes the skin, the spleen, lymph nodes, and bone marrow, in addition to leukocytes, which are produced within the bone marrow. There are several types of leukocytes, for example, lymphocytes, monocytes, basophils, eosinophils, and neutrophils. Causes. Cancer treatment can interfere with the functioning of the immune system in several ways. Because the immune system is busy fighting cancer, and fails to protect itself against possible infections. Lack of sleep, stress, poor diet, and other side effects of cancer treatment weaken the immune system. Chemotherapy can induce bone marrow and other parts of the immune system to malfunction, reducing the production of white blood cells. Radiotherapy can also affect the bone marrow, especially if the radiation reaches large areas of the body, such as the pelvic area, legs, chest, or abdomen. Cancers that directly affect the bone marrow or spread to the bone can compress the bone marrow cells, decreasing the production of white blood cells. Signs and symptoms. Infections can start anywhere, but the most common are in the mouth, skin, lungs, urinary tract, rectum, and genital areas. Talk to your doctor if you have any signs of infection. Fever, chills or sweating, sore throat or mouth ulcers, abdominal pain, pain or burning when urinating, diarrhea or sores around the anus, cough or shortness of breath, redness, swelling or pain, particularly around a cut or sore, abnormal discharge or vaginal itching. Treatment. If a person has neutropenia or a low total white blood cell count, the doctor may prescribe medications to force the body to produce more neutrophils or other types of white blood cells, and thus reduce the risk of infection. In the event of an infection, the patient will be treated with antibiotics or antifungal drugs depending on the type of infection. In case of neutropenia and fever, the patient must be hospitalized to receive antibiotics intravenously. Patients at high risk for developing an infection can be treated prophylactically with antibiotics or antifungals. Infection prevention. There are several measures that help protect people from infections, including washing your hands. Sometimes antibiotics are administered to certain people who do not yet have an infection to prevent them from getting an infection. Vaccination is one of the most effective ways to prevent infections. Infection prevention. In addition to the instructions received by the doctor, infections can be prevented as follows. Rest and maintain a balanced diet. Avoid crowded places and contact with sick people. Do not share glasses of drinks, utensils, and personal items, such as toothbrushes. Wash your hands frequently, especially after using the bathroom and before eating. Shower daily and use lotion to prevent dryness and flaking of the skin. Handle sharp objects with care, such as scissors or knives, and use an electric razor to avoid cuts. Avoid consumption of raw foods, such as meats, seafood, eggs, and wash raw fruits and vegetables carefully. Avoid contact with domestic animal waste. Wear gloves for gardening and housework, especially when cleaning. Brush teeth and gums with a soft brush. Infection prevention. There are many diseases, medications, and other treatments that weaken the body's natural defenses. Such weakness can lead to infections, which can also be caused by microorganisms that normally live harmlessly on or inside the body. A weakness can result from the following: extensive burns, medical procedures, drugs that suppress the immune system, radiotherapy, HIV. Tips: always wash your hands with soap and water. Stay away from sick people. Stay away from children who have received chickenpox or polio vaccines. Avoid locations with large groups of people, such as cinemas, stadiums, and churches. Take care not to cut yourself. If a cut should happen, clean it immediately with soap and water, using antiseptic if possible. If you are using a catheter or probe, check that you do not have any type of infection. TPS. Perform proper oral hygiene without injuring your cheeks, gums, and tongue. Take care of your skin, avoid scratching, always remembering that nails can drag infectious agents. Take care when you are close to animals, make sure you wash your hands after petting them. When eating food, remember to wash all vegetables and fruits well, do not eat fish, shellfish, or raw eggs.